So we have a pretty technically complicated case this morning. It's a patient who has a previous history of a really bad facial fracture. So this whole side of his face was completely fractured. And so he has plates in the bottom of his orbital floor and holding this part of his face together. He then, at a later time, developed a tooth infection of his upper molar, which then went into the sinus cavity where all this hardware is. So he has a horrible odontogenic sinus infection. The tooth has been extracted, but he's still having bad symptoms of sinusitis with purulent discharge, facial pressure, pain. And you can see here, when you look at the CT scan, this is the hardware here along the floor of his orbit. And this is the sinus that's just completely filled up with mucopurulent discharge. So our plan today is to go in and open up this sinus cavity, wash out all this infected mucus, and stabilize this infection so that it doesn't ultimately impact his hardware and require that to be removed.